All right, so for the next stuff we're actually going to consider this morning is us talking about amniotomy and amniotic hook, or they call it the amnio hook. Okay, any way you decide to start calling it first, So amniotomy just simply has to do with, okay, before a woman delivers, the amniotic sac has to kind of like get ruptured. So water kind of like pass here for the baby to be free from its balloon to come out. So if there's labor but the amniotic sac happens not to be ruptured, okay, the baby is not free from the balloon. Of course, you can't deliver the baby in a balloon, okay. So amniotomy is like we are just artificially trying to rupture the amniotic sac. Of course, it didn't actually happen naturally. So amniotomy is just a medical procedure where a healthcare provider intentionally ruptures the amniotic sac. That's a bag of waters. So of course they are doing this because they want to help progress or induce labor. Okay, so purpose is maybe there's labor but they just want to speed it up. Maybe they are doing this to monitor the baby more closely using internal devices. Maybe they are doing this to access the amniotic fluid for any signs, okay, of stress from the baby or something. Maybe they're also doing this to allow the baby's head to be able to descend. Just the first reason which I was telling you guys, okay, the baby can't descend in a balloon, okay, you have to rupture. So when is it done? Typically during active labor, when the cervix is dilated enough but the amniotic sac happens to still be intact, haven't ruptured yet. Okay, so it's not recommended, only if it is what medically indicated, because it has its own complications too. So this is an amnio hook or amniotic hook that they use for this artificial rupture. Okay, note that the head has like something pointed, right? It's white, so it's not really, I'm not really seeing it. So amnio hook is just a sterile, it's a plastic instrument resembling a crochet hook, like this thing that girls use for crocheting. So it's used to rupture or puncture the amniotic sac during amniotomy. Okay, so how it works is inserted through the vagina during vaginal examination. It's gently used to snag or rupture the membranes, so it will now allow the amniotic fluid to now drain out. This triggers more uterine contractions, okay, and this will bring about labor. So alternatives, there's also what is known as amnicot. There's also what is known as manual rupturing, where they can actually use the hand, okay, to do that. Okay, so risks and considerations is it may increase risks of infection, okay, after rupturing it and the labor doesn't come ASAP. Fluids are just there, infections will come up. Could lead to umbilical cord prolapse. That's the umbilicus going, the cord going down before the baby to block the birth canal. Okay, so it's not always effective in inducing labor. Okay, so that's just what this concept simply is.